for Village Heartbeat Village Talks. Tonight, we are going to be discussing what's new with COVID. Things have changed, but there are some things that are still the same, and we need to know what's the same. And we have an expert here to talk to us about the things that are changing and the things that are new. So, we're going to go ahead and just jump right in and get started. Let me share my screen. Come on in. Thank you so much for being here. Hold on. Let me share that screen. There we go. So, tonight we are going to be talking about what's new with COVID and talking about how COVID symptoms are changing. Tonight's Village Talks are presented by Village Heartbeat Inc. in collaboration with Village Heartbeat, Mecklenburg County, Atrium Health, and Johnson C. Smith University. Our host tonight is Dr. Charles Thompson from Shiloh Institutional Baptist Church, and he's going to come to us and welcome you here in just a moment. And our presenter tonight is Dr. Mark Johnson. He is the medical director of the CMC Infectious Disease Clinic, Atrium Health in Charlotte. He is also a professor of medicine at Wake Forest School of Medicine, also in Charlotte. There are three things that we need for you to do tonight, and that is, first of all, be ready with your questions. I know as the doctor talks to us, there may be some things that are coming up in your mind, and you'll want to know answers to that. Be ready to do that. We are asking for 5 volunteers to come in and work with us in a focus group. We're going to be going to a private room after this session and talking to us, just answering 5 questions for us. And we already have 3 people who volunteered. So those 3 volunteers will come, and then we'll ask a little bit later for 2 more. And then finally, we want you to fill out the survey. During the time that we are going to be together tonight, our IT is going to put the survey link in the comments so that you can click on it after we stop tonight. That's for everybody, not just the focus group. Everybody, please fill out that survey. That's going to help us know how to serve you better, help us to know what we are doing, how we're doing, and what we can do for you in the future. Okay, so it's really important to us. Thank you so much. So tonight we are going to have a presentation from Dr. Johnson, and then we're going to have an open forum. And we are going to ask Dr. Thompson if he will come on and say hello to everybody and give you a welcome.
Good evening and welcome to everybody joining us via Facebook and YouTube. We are just grateful on behalf of the Shiloh Institutional Baptist Church for you to join us on this virtual platform wherein COVID-19 lingers and remains certainly something that is impacting all of us. And it is our hope by partnering with Village Heartbeat Inc. and others that will be able to help keep ourselves and those we love safe. So thank you from the bottom of my heart for joining us today.
Thank you, Dr. Thompson. So now, Dr. Johnson, you have the floor. We are ready.
So I want to thank, first of all, Village Heartbeat and its partners, as well as Shiloh Institutional Baptist Church, for allowing me to be a part of your educational seminar today. And, you know, what I'll hope to do in this time frame is really talk about some of the basics around COVID infection and what we are now seeing as new emerging, issues around COVID, because as Dr. Thompson said, COVID is still here with us. And I'll show you a slide how it is still impacting communities across the country. But I think the most important thing for today is to really take home some certain points that, vaccination is still a very important tool, and being educated is also a very important tool to really hopefully protect you from COVID infection and the long-term consequences known as long haul syndrome or long COVID syndrome. And I'll talk a little more about that as we go through the slides. So can we have the next slide, please? So at Atrium, Atrium has a very strong mission to really improve health, basically elevate hope, and advanced healing for all individuals in the, the catchment area, as well as, the other institutions that we have partnered now with, which is reaching all the way down to Georgia, out to Alabama, and even our new affiliates that are in Illinois and Wisconsin. Our vision is really to be a national leader in for health, learning, and education, and that is being shown through the various developments of the things that Atrium has done so far, where we are now the 5th largest hospital system in the United States and have partnered with Wake Forest to basically now bring a full medical school to the Charlotte area, which hopefully will be opening in 2025, with a focus on primarily dealing with rural medicine and providing, medicine that is really considered to be that of, equality and diversity and inclusion. So the next slide. So we've already done this. I am with the medical director for infectious disease clinic at Kenilworth. I'm a full professor of medicine at the Wake Forest School of Medicine. Next. So we'll first start talking about COVID. We need to know what we're talking about. So this is a virus that most of you probably have been exposed to even before you knew there was a thing called COVID-19. Before the pandemic, there were at least 4 circulating coronaviruses that infected individuals almost every flu season. And most of you may have had, an infection in the past, went to your private provider and they said, oh, you had a viral syndrome. And this is one of the agents that were doing those so-called viral syndromes. But, the SARS-CoV-2 virus is a specific coronavirus in that family that has caused the pandemic that we all speak of as COVID. Now, we know that this is a respiratory, transmitted infection because primarily with most of these viruses like flu, rhinovirus, which is the common cold, adenovirus, which also causes viral syndromes. These viruses are transmitted when people cough, sneeze, speak in little water droplets, and they become very fine water droplets in the air, and you basically will inhale them, and they land in, the lining of your throat as well as your lung, and then start an infection. Now, COVID does affect, people in many different ways, and the symptoms can be almost nothing other than just having a stomach ache, to really being very sick where you have fever, chills, shortness of breath, difficulty breathing, and things like that. So next, so this slide really is going to talk to you about the symptoms. And what I want you to do is really just look at these symptoms. Because if you look at most of these symptoms as bullet points, most of these things are what we think of as a common cold, a viral syndrome, or even flu. There's nothing here that really says these symptoms are related to COVID. Most of these individuals that present to us, either in the clinic or the emergency room setting, will almost present like they've had a cold or they've had a flu. The one thing that I think that, got people kind of interested, was there any differences in the symptoms, was this loss of taste and smell, because that's something that you really don't see in other viral infections. So this was the kind of thing that we focused on when the initial, Delta virus strain started the COVID infection in 2019. And this was kind of the symptom that really made people think that, well, maybe you had COVID as opposed to any of the other respiratory infections. But with the new strains, I've seen people who literally come in talking about a little bit of sore throat. And basically we do a COVID test on, they're positive. And then we've seen other individuals who come in very sick. So you can present with many different symptoms. And the symptoms, as they say here, can start 2 days after exposure up to 14 days after exposure. So you can imagine how many people you could come in contact with and spread, this virus to other individuals. Next. So where are we at in the pandemic? So this slide really, I think, gives us a good idea of where we're at. I like to look at the numbers here on this slide. And you see here, there have been at least almost 767 million people infected with COVID. Remember, the pandemic, as we know it, started in late 2019, and here we are in 2023. That's 4 years. So if you divide that 767 number, you're talking about almost 200 million people a year that have been infected by this virus. And then when you look at the number of people who died, you do that too with 7 million, you divide it by 4 years, you're still talking about a little less than, you know, 2 million people who have actually died. And to make that real, you know, the population of the metro area of Charlotte is little over 1 million people. So you can imagine, you know, we have lost you know, basically 7 million individuals. That is almost 7 times the population of Charlotte over those 4 years. And that's a staggering number of people to die from a viral infection. The interesting thing is that if you ask people, you know, and this happens all the time in clinic with me, patients will come in and they'll say, oh, you know, I don't have to worry about COVID. But as the slide shows you here, there's still 14 million, well, to tell you the data, it's about 14,000 new cases of COVID a day, and still in the United States. So clearly this is not over. And then 1 out of 3 Americans really believe this, but that's not the truth from what we're seeing from the data. Next. So the COVID variants are these so-called mutants that you hear about when, you know, the news splashes, oh, there's a new mutant. So this virus has proteins on the outside that undergo rearrangement. And they undergo rearrangement because they're able to go into individuals who have either poor immunity or no immunity against COVID. And as a result, that virus can grow and then try to get around the immunity of that individual. And once the virus makes a combination that allows it to actually grow very quickly and then be spread quickly, then it's a real, what we call a mutant of concern. And so these viruses are much more contagious than some of the earlier strains of viruses. The chance of really severe disease is seen more in the unvaccinated individuals or elderly or immunocompromised patients. And they did not put on here people who have comorbidities like diabetes, hypertension, COPD, asthma, congestive heart failure, renal disease. So those are some of the other individuals that are at extreme risk of getting COVID. And then the major circulating strain now is an XBB.1.5, which you can see on this slide here. You know, it was a very small number of isolates here in February where we actually see this. And then you fast forward this to April and you just see how this mutant has become the predominant strain from isolates from people who tested positive. So really within, you know, in some cases, 2 months, you have a strain that's identified and then becomes the primary strain that's being transmitted between individuals. And this only happens, like I said, when the virus is making a mutation that allows it to be able to be spread very quickly. And once it's spread very quickly, can basically be causing disease enough to be further spread to individuals. And a lot of these individuals may not have immunity because the people who are getting infected mostly now are the people who are uninfected because they did not get vaccine from the prior mutant strains that were circulating in the population. Next slide, please. So we know that, you know, how do you protect yourself? I'm a real strong proponent of vaccines. I take care of most of the HIV patients in the clinic who are immunocompromised. And as a result, we have seen a lot of these individuals get sick, primarily because they did not want to get vaccines. They had, you know, the fear of the medicine environment. You know, Tuskegee is really alive and people have a lot of mistrust. But this is really one of the things that you can do is get a vaccine. They're safe, they're effective. You know, the Pfizer and Moderna vaccines were the ones that initially came out, and they protected us against, you know, the Delta and the Omicron, BA4 and the BA5 strains. The best protection is that, you know, you get a booster every 6 months from the last time you got a vaccine. And that's what you can do. And patients come into me and ask me all the time, so when do I get it? I tell them 6 months from the last time you got your last booster is the ideal time that you should be getting a booster. Now, we do have bivalent boosters out there, which means that like the old strain that were used to make the vaccine was usually just one strain. The new boosters are actually a mixture of many different strains. And the idea is to give your immune system a very broad response to many different strains to hopefully improve your immunity against strains that may come in the future. So I suggest that everybody tries to basically get get a vaccine. And as the fourth bullet point here is, if you want to basically get a vaccine, you can take down that 1-800 number, and I'll let you write that down if that's some time that you need to do that. So we'll give you a few minutes to do that. All right, so can I have the next slide, please? So we still want you to do the 3 W's, which is wear, wait, and wash. Hand washing is very important. I'm surprised at how many people do not practice hand washing and hygiene. Even some of our own colleagues, we have to constantly remind them, did you wash your hands? It's very important that when you're in situations with a high density of individuals, like, at an event, be it a wedding, a funeral, whatever, maybe you should be wearing your mask if you have increased risk of potential COVID infection. And those are usually people who are elderly. Those are people who have multiple medical problems, especially if your diabetes is uncontrolled, or your asthma, or your COPD or your heart failure is poorly controlled. You need to wear a mask. You need to really try to get 6 feet apart from people, and you really need to wash hands. Next. So this is some data around what's happening here in Mecklenburg. We looked as of May 4th, and at least 68% of the individuals here have actually gotten at least 1 dose. We look at individuals who've gotten at least 2 or 1 dose of the Johnson & Johnson, which was used very early in the pandemic. It was about 64% of the individuals here in Mecklenburg have gotten that vaccine. We see that about 60% almost of the individuals have at least gotten 1 booster or 1 additional dose. And the interesting thing is, with the better booster that's out there, which is, like I said, the bivalent booster, we are really lagging in terms of the number of community partners who have not gotten vaccinated. It's about 20%, which means 80% of these individuals are not taking advantage of the better booster, which is the bivalent booster. Next. So this gives you an idea of what the actual community level is in terms of the infection. It's currently very low. But as I said, if you've had, any high risk for severe illness, you need to really talk to your provider about how to protect yourself. Wearing a mask, wash your hands, and staying 6 feet from people are probably just not going to events where a lot of people might be the best thing to do. You want to stay up to date with your COVID vaccines, and you want to make sure if you get symptoms, get tested. Free tests are available in many different places. And you want to make sure you try to get them as early as possible, because once the COVID emergency is going to be ending, and a lot of the federal funding for some of these free tests through the mail and stuff will eclipse by the end of the summer. So you need to start looking for other areas of getting, free COVID tests, be it, the health department or the 1-800 number that I have just, asked you to copy. Next. So what has actually changed? So we have seen many different variants or mutants since the SARS-CoV virus actually, came to medical attention. The variants in the United States are usually monitored by the local public health offices, and usually in partnership with CDC and the state officials. We report that data to them on a weekly basis. And we get this data from people who are actually positive specimens and look at the genetic fingerprint of the virus, and then can report that to the CDC. And this really helps us in terms of, seeing what is impacting the community, and then hopefully guides us in terms of what will be included in the next iterations of the vaccines. So, we feel that, that this is the really way to kind of get the pulse of what's happening with COVID. And this also happens in the world. We now have just heard of a new variant in China that is of some concern. So, we have to keep surveillance on these mutants, because it's easy for a very deadly mutant to occur even in a foreign country, and somebody get on a plane and be here in 24 hours and then spread it to individuals here and then start a new pandemic. So this is how the work is actually done in terms of looking at what the mutants are. Next. So I want to talk a little bit about long COVID. So as you see here, there are many synonyms for this. It was first long haul COVID, but we just call it long COVID now. And the definition here is when you have symptoms, usually greater than 4 weeks or more after the initial infection, and there's no other diagnosis. So that means if you're having those symptoms that I had listed earlier, and I said they were like flu, but they're lasting a long period of time after the initial infection, and I don't have the ability to prove that you have, let's say, pneumonia, or you have a bad bronchitis or any other condition. In the absence of those other disease states, if you have these symptoms, you should be tested for COVID, and you most likely have long COVID syndrome. This can involve many different organ systems, even though this is a virus that is primarily, attacking the respiratory tree. We do see that it affects the kidney, it can affect the heart, it can affect your brain. And so those are the other systems and many others that are impacted by COVID. And these individuals at time can actually basically, be improving. And then all of a sudden you take a turn for the worse, and then you get worse. So that's one of the things with long COVID, that people will actually feel sometimes better, and then they will have these long lagging symptoms that I'll talk about shortly. Next, please. So the long COVID conditions are listed here. You can see it's about 20% of the individuals between 18 and 64 have some symptoms, and about 1 out of 4, which is 25% in age 65, have shown symptoms. And you can see things like kidney failure. You can see that these individuals have many different organ systems, like respiratory trees, that is impacted. So it is a disease that is just not only affecting the lung, but it's infecting many different organ systems in the body. Next. All right. So one of the things that we do see is that there's been a change in the symptoms, especially with some of the recent mutants, especially with Omicron and the new XBB.1.5 mutant strain, which is the predominant strain right now that's circulating through the populations. In the past, we would always look for, change of taste, smell, high fever, chills, look at for findings on their chest x-ray, and we knew it was probably Delta. But right now, these conditions actually present very insidiously. The patients will come in, and you think that they have very minor symptoms, and you think that they might have a common cold or just some kind of viral infection. And it's not until you do a COVID test and you find out it is actually SARS. I've actually had patients just come in talking about they have a little belly pain and diarrhea. And basically, when I've tested them for COVID, they were COVID positive. So, the general symptoms here are listed on this slide with tiredness, fatigue, difficulty breathing, cough, chest pain. Difficulty concentrating is also one of the things that tends to let you know that you potentially may have long COVID or COVID. People complain of brain fog because of the virus impacting the central nervous system. Headache, change of taste and smell does still happen, but very on a minor basis now compared to the initial Delta strain that we saw. And then stomach pain and joint pain tends to be, some of the symptoms that these patients have. So we can move the next slide. So what are the risk factors for long COVID? So having very severe COVID-19 symptoms are one of the risk factors. And this is why when I go out in the public, I always talk about why vaccines are important. Because vaccines really do three major things. They prevent severe disease, they prevent hospitalization, and they prevent death. And when you have to then look at the risk assessment and versus getting a vaccine and not, getting a single shot or a pair of shots of vaccine, depending on the vaccine, hurts a lot less than you getting severe COVID to the point that you can't breathe and have to go into the hospital and then progress in the hospital. And then ultimately, we have to intubate you. And you may not make it out of the hospital. I've seen a lot of young people actually die in this, time with COVID because they just didn't believe that COVID was anything to worry about. So when you have severe symptoms, chances are if you get over it, you potentially could have long COVID. Having an underlying condition like diabetes, cardiovascular disease, like I said, congestive heart failure, end-stage kidney disease, dialysis, COPD, any of those diseases, you should be concerned about getting COVID, and you should make sure that you do everything possible not to get COVID, because you are more likely to be the person who will get long COVID And we cannot tell you when it's going to end, because some people who have been infected since the late 2019 or early 2020 are still having symptoms now, 3 years later, if they have COVID. We have had a nurse in our clinic who wound up getting COVID. She could not even return to work. And she's a young woman in her early 30s, was perfectly healthy for the most part, and now has been out of work because she wound up getting long COVID syndrome. Can barely concentrate now, can barely focus, has a whole bunch of other somatic complaints in terms of, things that's happening with her body. Being not vaccinated is really, not a good thing. I still strongly believe in vaccines. I think, the benefits of vaccines outweigh the risk of taking the chance to getting COVID. So being not vaccinated is, those individuals are now getting COVID and most likely are going to get long COVID. And then these individuals with multisystemic inflammatory syndromes, which is a syndrome in which people have these inflammatory conditions like arthritis and other things, they are at increased risk of getting COVID. And this is probably because they have an overactive immune system that reacts to the COVID. All right, next, please. So what are the protective factors? So we talked about avoiding, individuals in, closed spaces that who are suspected of having COVID is a way to do it. You need to stay up to date with your COVID vaccinations. Improving, indoor ventilation is very important. If you think back to how TB was treated back in the 30s and 40s, people went to sanitariums and they were in these wide open country areas to basically get good ventilation. And the same principle happens with all respiratory viruses, even flu, common cold, which is the rhinovirus, adenoviruses, paramyxoviruses. All of these cause these viral syndromes. And even in the winter, you should be allowing ventilation in your house to have circulation of the air so that you don't harbor, organisms just being trapped in the house from October all the way until when it gets warm in the spring. Proper hand washing is important because all it takes is one person to come in after sneezing and coughing and not wash their hands and touch the door handle of the refrigerator. Then everybody gets it, or toilet flusher, or basically things like the remote for the TV or for the cable, shared computer keys. All of those things are what we call common touch points in the house. And so not washing your hands and then infecting something like that can really, spread COVID or infections through your household. Next. So why get vaccinated? And I think I've said this already. For those that are vaccinated in the initial series are less likely to get COVID. And we have seen that. You may get the vaccine and no one is saying that it's going to be 100% protecting you against COVID infection. But even if you do get reinfected, it tends to be very mild. You don't wind up in the hospital. Individuals are less likely to have negative outcomes when they're vaccinated. And that's really talking about long COVID syndrome or just having, worsening of your disease, underlying disease. I had a lady who had just very mild asthma and, decided to go to a funeral. When I told her don't go to a funeral, she wound up getting COVID. Now she walks around with an oxygen tank because she's scarred her lungs so significantly she cannot breathe without portable oxygen. So this is a example of doing something and basically having a negative health outcome. You want to receive boosters to make sure you boost your immune system continually, because as you get re-exposed in terms of a COVID variant that's in the vaccine, you develop more antibodies that are going to protect you against COVID infection. And that's why now we try to use a bivalent, which means 2 or more various strains in there to try to really broaden your immunity response to any potential COVID exposure. So research has actually shown here that people can have breakthrough infections. They get infected despite being vaccinated, and it happens. But they usually have better outcomes, even though, when you look at them compared to people who've never been vaccinated. And vaccines really are part of the thing that we're all part of a community. Everybody likes to say, well, I don't want the vaccine because I this. But you as an I are part of a community. And, there have been many other examples in infectious disease where if you treat the community, you really protect that community from infection. So if everybody in the community wound up getting vaccinated, you potentially would have much milder cases, and the virus eventually would probably start to have nowhere to grow in that community because most of the individuals would be immunized. And this is what we call, the herd phenomena. And it was seen in animals where if you had a organism and you inoculated all of the animals in the pasture, even if another cow brought in that organism into the pasture, the initial cows did not get the infection. And it's the same principle that happens with humans. All right. So can we have the next slide? So testing for COVID is really important. You can purchase them through, pharmacies, even Walmart has, I've seen them in Walmart and Target. You can get them through the federal program for a short time. You can still try to get on and get the 4 free tests. You can go through this Project Access COVID test in North Carolina. North Carolinians can get up to 10 rapid tests while the supplies are limited up until this June 30th. And there is the website as you see it there. And then there's several organizations like the health department here and community-based organizations. Even some of the churches have been able to get COVID tests for their, congregants and make sure that they get access to home testing. Next. So the reminders are here that we should all be following is that you really need to stay up to date with your COVID vaccines. And if you have symptoms, get tested. I can't tell you how many people who have been having symptoms and refused to get tested or just chose not to get tested and wound up infecting their whole family or coworkers. So make sure that if you are having symptoms, get a rapid home test. If you're positive, just isolate and call your medical provider. Wash your hands regularly and make sure that you wear a mask, and especially any situations where there's a high number of people in very close quarters. And I think these are the very simple things that you can do to really protect yourself. Next. So as far as a wellness check here, we realized that COVID had a lot of physical attributes to it in terms of causing disease, but it also caused a lot of mental health concerns. So about 20% of the individuals will actually have a mental disorder in any given year. But, COVID really caused a lot of people to be isolated. And the isolation comes with depression or worsening of underlying mental health conditions that it might have already been there. So some of the tips that we talk about wellness with people in terms of improving their physical and mental health are listed here. Increasing your physical activity is very important. We know that through physical activity, these natural compounds that are called endorphins, they're like your own natural heroin or drugs, actually can make you feel better and actually more clinically sharp in terms of how you basically think about things or your concentration with reading or calculating. So physical activity is really important. Socializing is important to have a social contact with people. Obviously, eating healthy is important because your immune system and your body needs to be healthy in order to respond. Sleep is very important. Sleep really impacts a lot of the organ systems in the body and can dramatically really impact your immune responses and your overall health. So sleep is important. Participating in hobbies is usually to really stimulate your mind to focus on something that you really get pleasure from. And then you want to manage the effects of stress, create very healthy boundaries in terms of work and life. And we're seeing a lot of that right now in the workplace, where we are finding it very hard to keep people working because now they have realized that they have to have work-life balance. So I think this is something that people have to really, think that they have to work on very hard to do, to get clear that, basically, there is very positive things that you can do in life, spending time with your family, doing an exercise, doing a hobby to basically balance out the stress of work. Practice gratitude and positivity. I'm gracious every day that, I get up and I go to work and I take care of my folks. And that's how I look at my graciousness and my positivity. Meeting with a healthcare provider regularly, I don't know if that's really going to make you well or not. In some cases, it depends on your relationship with your medical provider, but that is the person who is going to really give you, the guidance, or let you get to an individual who can seek, and give you the answers to your questions. So I think this is the last slide, and we have the next slide. I think that's it. So yes, we want to thank you for at least paying attention to this talk today. And I'd like to make this a little more informal and just open this up for question and answer for anything that you want to really ask.
So we are checking the comments to see if there are any questions. Bethany, do you see questions in the comments? Okay, Bethany has some questions that are coming from people who are on Facebook and YouTube, and she's going to put them up so you can see them, Dr. Johnson.
All right.
While she's putting those up, okay, there we go. Okay, I'm the pastor of a church that just installed a new HVAC air conditioning system. We installed ionizers in the air handlers on each of the 15-ton units we installed. What is your opinion of these?
So I guess in terms of the ability for them to sterilize air.
Yes.
So what I can tell you about HIVAC is that it's really important about the filter size, because there are different types of filters. When you go into like the stores like Walmart and Home Depot, you'll see that there are really bargain basement filters that don't really filter very much other than large particles of dust. And then you got the HEPA filters, which have a very small pore size that can filter out even viruses. But the problem is that viruses are so small that they can usually go through a filter, but they'll capture a lot of the other organisms that might be in a household setting, or a building like this. The ionizers are meant to really work if they have ultraviolet light, and I think that's the question that I would ask, is if these ionizers have ultraviolet light, because ultraviolet light is basically germicidal. And it does wonders for bacteria and some of the viruses that have a lot of fat in their envelope. So that's what I would say about that.
Okay, thank you. And what's our next question?
I've not seen an increase in blood clots. There were some reports of basically these young men getting, what we call a cardiomyopathy. They were basically having myocarditis, which is basically swelling of the muscle. We now believe that this was probably, just the immune response to the vaccine itself. It wasn't the vaccine per se. And that's what we actually see in flu. More people die from flu primarily because they have an overactive immune system, which is the response to the virus that you inhale. And a lot of young people die from flu, mainly because their immune system is like a runaway train. The immune system is meant to see an organism and then say, okay, I have to remove this, respond appropriately, and then remove it and shut off. But in these young people, what happens is the immune system goes like in hyperdrive, and basically it just overstimulates, itself to the point that it will kill the organism, but it also will create what we call a cytokine storm, or basically a scenario where the organs themselves just are attacked by the immune system. So they attack, your liver, your kidney, your spleen, whatever. And then as a result of organ failure, you die. And so, there have been some reports of people having mainly DVTs, but we have not been able to link them to clots. You have to remember, some of these reports are people who are older and already prone to clots. You know, there are people who probably have venous insufficiency where they got varicose veins or they got low flow going to their leg, or they may have cancer that was not diagnosed, or they may have other medical conditions that might put them at risk of clotting in the first place. And some people are just not moving enough, and as a result, their blood pools and then it clots and they get a clot. So I don't have not really seen any data where it increases your propensity to get clots. I think you have to always ask, in what population are we talking about? Because I believe that most of these are people, probably older individuals that have other medical conditions that put them at risk of clotting. Yes, I think you still need to get a booster. If you can, I would say get the bivalent booster, which has got at least various strains of Omicron in it, and that will broaden your immunity. Because most of us, even myself, I got the original Moderna vaccine, which was Delta, and then when I got the first booster, it was still Delta, but a different strain of Delta, and then got the bivalent booster, which now gives me Omicron. And so Omicron is even though the most common strain is the XBB.1.5, it is still very related to Omicron. So basically, if you get the booster, you're going to get protection against it. And the idea is, like I said, you basically want to really broaden your response to a new strain that may come out there. So the more boosters you get, the better your potential protection is. There is some discussion at the FDA now, and they're very quiet about what's going on, but there is some discussion of putting multiple strains in a possible once a year vaccine, almost like we do with a flu vaccine. So you probably should just keep your ears to the ground. You may be hearing something sometime, before the end of the year, that they will be recommending a new vaccine that will be given once a year to try to give you immunity. I think that's a decision of parents, what they want to do with their children. I think this is a very, I guess this is a very controversial discussion. And I think this is a discussion that parents need to decide how important it is to have their child immunized. I mean, I have immunized, my children, even though they're adults. But, if I had younger children, I would probably immunize them. I would think that, if they're in a setting where they're around a lot of people, I don't want them getting COVID. And if it means just me giving them a shot and that being localized pain or a flu-like illness for a day or two, that's still better than me having been in the hospital, in a pediatric ICU or, respiratory unit of the hospital, seeing them, suffering because, they didn't get a vaccine. But that's my personal take on it. Yeah, I think that is the issue. I mean, we have, even at the hospital, we have certain units where we have UV light when people go in and out of certain units, like bone marrow transplant, things like this, because you don't want to. But that's the problem, is that you will have some degradation over time. I think if you have 3 vaccines and it's 6 months from your last one, you need a 4th one. And probably a 5th one and probably a 6th one. I don't think COVID is going anywhere. So how do lay people reconcile governmental agencies lifting pandemic measures with counsel received here that COVID is still a threat? Can someone rephrase that maybe to whoever wrote it? Can you come off of mute and maybe just rephrase it?
So I would say, to rephrase it, the government has said that they're lifting these. I think you may be speaking of the emergency status of the pandemic
Right.
with the council. That some people think it's over because that has been said. And how do you reconcile? How can we talk to people and help them understand that COVID is really still a threat?
Well, I think the thing is that the emergency user agreement was really only in a pandemic. So the pandemic is very well defined epidemiologically. And once you don't meet that criteria anymore, you really can't have an emergency user agreement for anything. You have to basically go back to general public health intervention practices to really address the threat at the time. So in this case of COVID, we still know that COVID is here. All you have to do is look at, you can go to the health department of the state of North Carolina and look at the number of people that are being still tested positive. The question really is how many of those people who are testing positive are unvaccinated, right? Because that is where the major infections are still going on, is in people who are unvaccinated. And so for me, the way that I try to tell people, if you're unvaccinated, you got a target on your back. If you have been vaccinated, you can still get COVID, but you most likely are going to have very minimal or no symptoms, and you're probably going to do well with it, and you're going to recover. But the people who are unvaccinated are the ones who are usually getting very sick, winding up in the hospital, and usually, taxing the healthcare system in terms of because they don't want to get a vaccine. Now, there are other people who have, long-term medical conditions, and if they have not been vaccinated or they're not keeping up to date with their booster, they should be encouraged to do so, because once you already have a risk, for infection, and you're not keeping up to boost with your boosters, you then risk of getting severe disease, potentially a long hauler syndrome. And long hauler syndrome is no joke. I mean, it's a thing that you have the right to protect. It's funny when I ask people, well, when you came to clinic today, did you set your alarm in your house? Yes. Did you, when you got in your car, did you put on your seatbelt? Yes. When it was raining outside, did you put up your umbrella? Yes. You can ask all these questions and they'll say yes. But then when you say, okay, did you get a COVID vaccine or a flu vaccine? No, I don't believe in it. So that's where you get that disconnect, and you have to really try to address why they are having that disconnect. Some of it's the trust, the trust of the medical community. Some of this, the belief in these anti-vacciners that are put out on the internet and don't have any real science to back it up. It's just a matter of them stringing some facts together and then making it into something that it really is not. But I think we have to be very steadfast and say this thing is not going to go away. We have the ability to basically be taking care of it. You need to be educated. You need to practice what you preach. You need to wash your hands, wear masks when appropriate, get vaccinated, do all of the things that I just talked about in this. And more importantly, try to get people who are unvaccinated on vaccine. Because the reason we have these mutants is because we have a worldwide population of a perfect environment for this virus to constantly mutate and get worse and worse. And so until we deal with that, we are going to have this problem. So I think that's really, my answer to this question. I think that's a discussion that you need to have with the pediatrician of your child, because they know your medical history of that child. And so I think that's a fair question for that provider who takes care of your child and knows their history.
Okay, thank you all so much. Great questions, all. And thank you so much, Dr. Johnson, for answering our questions, giving us information. I'm sure that you've heard some things that you've known, that you have learned since this whole COVID got started, and you learned some things that were new tonight. And that is our goal. So we want to thank you for that. And I want to let you know that just a couple of things. I want to remind you that we are looking for 5 volunteers at this point. We have 2. We are looking for 3 more volunteers to participate in a focus group after This is over. If you'll just put your name in the chat, Bethany will take your name and we will send you an email. This is going to need to be for people who have registered for this event because we don't want you to put your email address in the comments. So we just need to get your name and we will send you a link to where that focus group room is right after this is over. The other thing is we need you to fill out our survey. We want you to tell us how we have done and what we can do to help you in the future, what kinds of things we can bring to you. So Bethany, has that been put in the comments? Okay, so the link is already in the comments section and you can feel free to do that. One of the things that we're going to do now is we're going to bring on Jessica Montana, who is a health program supervisor for Mecklenburg County Public Health. Jessica is going to come on and she is going to let us know about some resources that are available through the County of Mecklenburg. Jessica?
Hello, good evening, everybody that's joining us virtually today on this new platform. I kind of like it. Can you still see me? Okay. So
Oops.
I am going to, can you hear me?
Yes.
Yes. Okay, wonderful. All right. So I am going to share with you my screen. Okay. Good. All right, so this is, so again, my name is Jessica Montana and I'm with the Mecklenburg County Health Department. And so I wanted to share with you this resource, which we have online, and it's, you can see the site over there and you'll also get the link so that you can access this. And basically this is where we're updating all of our information. We have our most recent data here. But what I really wanted to show you is the resources. So if you click on View Resources, there is some information here that you might find useful, maybe for your congregation or for any events or anything that you may have, or just personal information. So here we have information about the vaccines. So if you need to reference anything in the future regarding the vaccines, I really like to point out that here you can find the flyer where you can, with the county locations, the health department locations where you can receive the vaccine. Okay, so you can, there's phone numbers, there's, and there's the times that the clinics are open and the locations. So you can find that here if you're ever interested in coming to the health department to get your vaccine. And also there's some information on safety. So I really like this one because it explains what to do if you were exposed to COVID. So should you isolate, what you should do, all of that is on there. And then what to do if you have symptoms, that sort of thing. All that information is on here. And going back to testing and treatment. So there are some treatment options. Oh, actually, I like this one too, because this one's the at-home testing guide. So what to do if you get a positive result, if you test at home, or a negative result. And also this one, which tells you about the different options for treatment if you do happen to need treatment for COVID-19. And we also have information on assistance. So there is a flyer here as well. If anybody is struggling with COVID-19, with mental health or substance use, there are some resources here for that. And also free and low-cost clinics and dental resources are available here as well. The last couple of things I wanted to point out here is that there are some other resources at the bottom. There's also a hotline that you can call if you have any questions. And then there's this bot down here. And so this is an automated bot that will come up. It should come up anyway. And you can ask questions. There it goes. And you can ask questions here as well, and it'll direct you exactly to the information that you need. And I'm looking for, oh, and then I skipped over this part, but this part is also really good because this is our community engagement request form. So if you have an upcoming event and you'd like somebody to come and talk about COVID, if you'd like to have some masks or test kits available at your event, you can request those here. And we can come out and support that with you as well. So as I mentioned, this link will be shared with you. I just wanted you to see what you would have available if you went on that website.
Great. Thank you so much, Jessica. We appreciate that. So you have a lot of resources that are available to you. After this is over, for those of you who registered, well, we do have it in the comments, correct, Bethany, the link? So you can go there from here. That will stay up with this video. And for those of you who registered, I'll also send that to you afterwards. So you'll have it in a very easy place to get to in your email inbox. And we want to thank everyone. We want to thank Dr. Thompson and the Shiloh Institutional Baptist Church. Thank you, Jessica, for what you brought to us. And thank you, Dr. Johnson, for all of that wealth of information you gave us. We really appreciate your time and your expertise. And we are so happy that everyone has been able to come in and share and ask their questions. Before we go, I just want to check one more time to see if we have any other volunteers for the focus group. What I will do is after this is open, after we've closed for tonight, I'm going to send you an email, and I will give you a link to the room where we'll talk for just a few minutes. Do you see any other names, Bethany? Okay. Well, we want to thank you, everyone. Have a wonderful evening and see you at the next Village Talk. Good night, everybody.